Welcome to today's lecture on Bartter syndrome, a rare inherited disorder that affects the kidney's ability to regulate electrolytes. In this comprehensive script, we will delve into the molecular genetics, pathogenesis, clinical features, diagnostic considerations, management strategies, and long-term outcomes associated with Bartter syndrome. We will also discuss the role of ion channels in renal physiology, genetic counseling implications, renal biopsy findings, and the specific challenges faced during pregnancy. By the end of this lecture, you will have a thorough understanding of Bartter syndrome and its impact on renal function and overall health. Bartter syndrome is primarily caused by mutations in genes encoding proteins involved in renal salt transport. These mutations result in impaired ion transport across renal tubules, leading to electrolyte imbalances. Understanding the specific genetic mutations and their inheritance patterns is crucial for accurate diagnosis, genotyping, and counseling of affected individuals. Renal ion channels are integral for maintaining electrolyte balance in the body. In Bartter syndrome, dysfunctional ion channels, such as the thiazide-sensitive sodium chloride cotransporter, negatively affect the reabsorption of sodium and chloride ions in the renal tubules. This disruption in electrolyte transport leads to volume depletion, metabolic alkalosis, and various clinical features associated with Bartter syndrome. Neonatal Bartter syndrome is a severe form of the disorder that presents shortly after birth. It is characterized by polyuria, dehydration, failure to thrive, and electrolyte imbalances. Understanding the underlying pathogenesis, recognizing the clinical features, and performing appropriate diagnostic tests are essential in managing neonatal Bartter syndrome and alleviating its associated complications. Antenatal Bartter syndrome refers to the form of Bartter syndrome that presents during fetal development. Genetic mutations affecting ion channels involved in renal salt transport lead to abnormal electrolyte homeostasis and impaired renal function during prenatal life. Recognizing the prenatal manifestations and performing genetic testing can aid in early diagnosis and appropriate management. Bartter syndrome and Gittelman syndrome share similarities in terms of clinical features and electrolyte imbalances. However, understanding the subtle differences in clinical presentation, biochemical profiles, and genetic characteristics is essential for accurate diagnosis and differential management of these disorders. Genetic counseling plays a crucial role in Bartter syndrome, as familial inheritance patterns have significant implications for affected individuals and their families. Understanding the importance of genetic counseling, the challenges faced in providing accurate information, and the implications for future generations can aid in managing Bartter syndrome effectively. Proper management of electrolyte abnormalities is crucial in Bartter syndrome to prevent complications and maintain overall health. This topic will explore various strategies, including pharmacological interventions such as diuretics and potassium supplements, as well as non-pharmacological approaches like dietary adjustments and fluid management. Ongoing research continues to identify novel genetic mutations associated with Bartter syndrome, unraveling new insights into the disorder's pathophysiology. Understanding these mutations and their implications can aid in developing targeted therapies and personalized approaches to manage this complex disorder. Renal biopsies provide valuable information regarding the histological changes occurring in the kidneys of individuals with Bartter syndrome. Familiarizing ourselves with these findings and their diagnostic significance offers a valuable tool to confirm diagnosis, evaluate disease progression, and guide appropriate management. Bartter syndrome can have long-term implications on both renal function and overall health. Exploring the potential complications, monitoring strategies, and interventions to optimize long-term outcomes is essential in providing comprehensive care to individuals with Bartter syndrome. Dysfunction of the thiazide-sensitive sodium chloride cotransporter is a key feature in Bartter syndrome. Understanding the mechanisms underlying its impairment and exploring potential therapeutic implications can guide the development of targeted interventions to improve electrolyte balance and overall renal function. Experiencing Bartter syndrome during pregnancy presents specific challenges for both the mother and the developing fetus. Understanding the impact on maternal health, fetal well-being, and navigating the complexities of managing electrolyte imbalances are crucial aspects in providing optimal care for pregnant individuals with Bartter syndrome. In conclusion, Bartter syndrome is a fascinating disorder that involves intricate molecular genetics, complex renal physiology, and a wide range of clinical manifestations. Through an in-depth exploration of the various topics discussed in this lecture, we have gained insight into the diagnosis, management, and long-term outcomes associated with Bartter syndrome. By continuing to advance our knowledge and understanding of this rare disorder, we strive to improve patient care and provide better outcomes for individuals affected by Bartter syndrome.